With the new year, many people have a goal for weight loss. Surgeon Dr. Ben Clapp with the Hospitals of Providence joins us live in the studio. Thank you for coming in.
Thank you for having me.
What is the main thing when it comes to weight loss surgery, what people should know, and the choices that they have?
Well, I think the main thing to think about with weight loss surgery is first of all, if you meet the criteria. So somebody that meets the criteria for weight loss surgery has to have a body mass index of 35, which is generally about 100 pounds overweight. And then a second thing I would tell a patient that's considering it is it's actually a very safe thing to do. It's unsafe to be overweight and to have all the associated medical problems that you have with being morbidly obese, but it's very safe to have surgery. In fact, it's gotten to the point where it's as safe as natural childbirth.
What about those people who are they're not at 100, they're about 90 pounds overweight?
Well,
what would you recommend for them?
We would look at that on a case-by-case basis. 100 pounds is just a benchmark, but it depends on their height and their weight, so they may actually qualify for bariatric surgery. However, if they don't, but they're kind of inching that way, there's a couple of other options that we have for them. There's some medical treatments, such as medications, and I also offer what's called an intragastric balloon, where I can put a balloon endoscopically into a patient's stomach, not with surgery, and it's completely reversible. In fact, it's only designed to stay in for 6 months, and they can lose about 40 to 50 pounds with that.
Wow, that's interesting. What is the process like for somebody who goes through weight loss surgery?
Well, it's something that we just don't jump to. The patient has to be really committed to it, and they have to realize that what we're doing is giving them a tool for them to work with so that they can change their lives in a healthy way. So everyone has to see a psychologist, everyone sees a dietitian, everyone goes through multiple classes and an educational process, because we want, when we give them this tool, for them to be successful with it and to know how to use it and to make a lifestyle change for the rest of their life.
Because is there a possibility that they can go back to being 100 pounds overweight?
Oh, absolutely. Absolutely. If a patient isn't willing to commit completely and use the tool, if they start to step outside of the dietary guidelines and boundaries, then they can gain weight again. So again, that's one of the reasons that we don't just jump to this. It's a long process that will last anywhere from a month to 6 months before they get surgery. And
then that's why there's counseling and all of that for. Do patients usually get to talk to other people who had the surgery too?
That's a great point. At the Hospitals of Providence at the New Me Bariatric Center, we have a support group meeting every month, and it's on the third Wednesday of the month at 5:30. In fact, everybody's welcome to come, even if they're not a patient, just to see what it's about.
Everybody come on in.
Yeah, come on in. We'd love to have you. And you can meet people from before surgery to 10 years later, 15 years later, to people that just had it last week, and I think it's a great resource.